it's very important that we realize that physicians are not clairvoyant. They cannot determine whether days, weeks, months a patient will die. So when the law states that the physician must determine that a patient is terminally ill and could die within 6 months, that to me is ludicrous. I could give an example of what's happened in my husband's practice. When he was a resident at Children's Hospital, he saw a patient in the clinic. The patient had been operated on by the renowned neurosurgeon Dr. Harvey Cushing and was told he had a malignant brain tumor and was given the advice that he only had 6 months to live. He decided he would spend all his savings and do things that he had always wanted to do in life. He went beyond the 6 months. He couldn't get a job. He couldn't get insurance. And actually, this was 40 years after he was given the diagnosis, and he was quite angry that a doctor would have given him that information. So they went back and they looked at the original pathology slides to see if the diagnosis was correct. And in fact, it was correct. So it tells me, it tells the world that we can not always predict things accurately. There are definitely lack of safeguards. An incapacitated patient cannot go and pick up the prescription himself or herself. On the other hand, when they do get the medication, anyone, being a caregiver, a family member, a young child, could have access to that medication, which is quite dangerous. And ultimately, the patient might never receive it. So there really is nothing that really would mandate that that medication be in the hands of only the patient who chose to use it.